This medication helps strengthen the body's natural defense system, known as the immune system, to lower the risk of infection in people with a weakened immune system. It is made from healthy human blood with high levels of antibodies that fight infections. It can also increase the blood count in people with a blood disorder called idiopathic thrombocytopenia purpura, ITP, which is necessary for stopping bleeding and forming blood clots. In addition, some immune globulin products can be used to treat muscle weakness problems and certain nerve disorders, as well as prevent blood vessel disorders in people with Kawasaki syndrome. The dosage and timing of taking this medication should be determined by a healthcare professional based on individual medical conditions. This medication is administered either by injection under the skin or slowly into a vein, as directed by your doctor. Your healthcare provider will start the medication slowly and monitor you closely. If you have few or no side effects, the medication will be given faster. Let them know right away if you experience any side effects such as flushing, chills, muscle cramps, back/joint pain, fever, nausea, vomiting, or shortness of breath. The infusion may need to be stopped or given more slowly. The dosage and frequency of the medication will depend on your medical condition, weight, and how you respond to treatment. If you are administering this medication to yourself at home, make sure to learn all the preparation and usage instructions from your healthcare provider. Before using, check the product visually for any particles or discoloration. If you see either of these, do not use the liquid. Also, learn how to store and discard medical supplies safely. It's important to use this medication regularly in order to get the most benefit from it, and make sure to keep all your medical and lab appointments. Some common side effects of Octagam Vial include flushing, headache, dizziness, chills, muscle cramps, back/joint pain, fever, nausea, vomiting, pain, redness, and swelling at the injection site. If any of these effects persist or worsen, notify your doctor. It's important to remember that this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Octagam Vial may increase your blood pressure, so it's essential to monitor your blood pressure regularly and inform your doctor if the results are high. Be sure to contact your doctor immediately if you experience any serious side effects such as easy bleeding/bruising, fainting, fast/irregular heartbeat, unusual tiredness, severe headache, stiff neck, drowsiness, high fever, sensitivity to light, eye pain, severe nausea, vomiting, or any lung problems that may occur after your treatment. While very rare, a serious allergic reaction to this drug may occur. Seek immediate medical attention if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. If you're in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. This medication may cause serious kidney problems, especially if you already have kidney issues, diabetes, a blood infection, a certain blood problem, or severe dehydration. It may also rarely cause serious blood clots, especially if you are an older adult, severely dehydrated, have a catheter near your heart, or have a history of blood clots or heart/blood vessel disease. If you use estrogen-containing products, you may also be at increased risk. Before using this medication, discuss the risks and benefits with your doctor or pharmacist. The risk of kidney problems and blood clots may be decreased by infusing this medication more slowly or using a less concentrated form if available. Being adequately hydrated before receiving this medication may also help reduce these risks. If you experience sudden weight gain, swelling, changes in urine, shortness of breath, chest pain, dizziness, severe headache, or vision changes, seek medical help immediately. Before using Octagam Vial, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to other immunoglobulin products. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. Also, Be sure to inform your doctor or pharmacist about your medical history, especially if you have certain immune system problems, diabetes, high blood pressure, high blood fats, migraines, current blood infection, kidney disease, or severe dehydration. Octagam vial may cause dizziness, and the use of alcohol or marijuana can intensify this effect. It's important to avoid activities that require alertness until you can do them safely, and limit alcoholic beverages. If you are using marijuana, discuss this with your doctor. Some immune globulin products should not be used in people with certain metabolic hereditary problems, so it's essential to ask your doctor for more details. This medication may also affect your response to certain live viral vaccines, so make sure to inform your doctor of any recent or planned immunizations/vaccinations. Finally, it's important to note that Octagam vial is made from human blood, and while it is carefully tested, there is an extremely small chance of getting infections from the medication. It's best to consult your doctor or pharmacist for more information. When taking Octagam vial, it's important to be aware of potential drug interactions that could impact how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Octagam vial include drugs that may harm the kidneys, such as aminoglycosides like gentamicin, as well as water pills like furosemide. Additionally, this medication may interfere with certain lab tests, such as blood sugar tests and blood type tests, which could potentially lead to false test results. This interference can have serious, possibly fatal consequences. Make sure that lab personnel, as well as all of your doctors and pharmacists, are aware that you are using Octagam vial, and which type of blood sugar testing strips you use. If someone has taken too much Octagam vial and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center. In the US, you can call 1-800-222-1222, and in Canada, reach out to your provincial poison control center for assistance. Before starting Octagam vial, your doctor may conduct various lab and medical tests such as complete blood count, kidney/liver function tests, urine volume, and blood pressure. It's important to keep all medical and lab appointments and consult your doctor for more details. When using Octagam vial, it is crucial to take each dose on time. If you happen to miss a dose, it is important to consult with your doctor or pharmacist to establish a new dosing schedule. It is important not to take a double dose to make up for a missed one. Be sure to follow the product instructions and ask your pharmacist about the best way to store Octagam vial. Make sure to keep all medications out of reach of children and pets. Do not dispose of this product by flushing it down the toilet or pouring it into a drain unless instructed. Instead, properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.